Hello, my name is Chow, and I am the first affirmative rebuttal. So the negative states that focusing on rehab will fail to reduce the rate of drug use, and that drug addicts lack incentive and means to seek treatment. Her first point is that private health insurance doesn't cover substance abuse. Based on recovery.org, a rehab information site, the American Medical Association recognizes alcoholism and substance addiction as diseases, forcing health insurance companies to recognize the need for treatment coverage. In addition, the 2008 Affordable Care Act and Mental Health Parity and Addiction Equity Act require that both public and private insurance policies must cover substance abuse treatment to the same extent that they cover other medical conditions. Her second point is that addicts have a difficult time completing treatment on their own. This is true, but it fails to prove a point because in rehab, patients would not be completing treatment on their own. Based on rehabs.com, individuals in rehab participate in group and or individual therapy sessions to recognize and address the underlying causes of their addiction and develop relapse prevention skills to maintain sobriety. In addition, there is aftercare, in which near the end of a rehab treatment program, the staff will work with the patient to develop an appropriate aftercare plan. This may include some combination of support groups, ongoing therapy, and sober living arrangements. The negative third point is that treatment centers are costly. My counter-argument is that drug addiction is far more costly. Based on the Recovery Village, on rehab success rates, in a report published by the Office of National Control Policy, the average monthly cost of cocaine per user was $830, heroin to be $1,457, and meth to be $655. Meanwhile, the average monthly cost of drug-related health care per user was $31.83. Many facilities also offer different payment methods to accommodate individuals and make it easier for them to pay for rehab even without insurance. There are payment plans and there's also sliding scale, in which they will only be required to pay what they can reasonably afford so that people with lower incomes will be expected to pay less than people with higher incomes. Many treatment facilities also offer rehab scholarships where the facility will cover part or all of the cost of recovery. The negative's fourth point is that rehabilitation is not always effective. The negative has a statistic that 50 to 90% relapse. This is a false statistic. The National Institute on Drug Abuse, according to the National Institute on Drug Abuse, relapse rates for drug addiction vary between 40 to 60%. And this is similar to relapse rates of type 1 diabetes, which is 30 to 50%, and hypertension and asthma, both 50 to 70%. Since addiction is a disease, we see that rates of drug relapse are comparable to other common diseases. Essentially, success rate of drug treatment programs does not depend on achieving complete sobriety, but rather on improving the addict's quality of life as a whole. That is something that the statistics fail to measure. Something else that the negative mentions is that lax drug laws encourage drug use. Based on Cato by David Boz, who is a subcommittee on criminal justice drug policy and also in the United States House of Representatives, the Office of National Drug Control Policy reported in April 1999 that state and local governments spent an additional $15.9 billion in 1991, a whole 13% increase from 1990. So total drug arrests are now more than 1.5 million a year, and over 80% of the increase in the federal prison population from 1985 to 1995 was due to drug convictions. Yet, all the arrests and incarcerations haven't stopped the use and abuse of drugs, or the drug trade, or the crime associated with black market transactions. As stated in the article, cocaine and heroin supplies are up, and so the more our custom agents interdict, the more smugglers import. The negative also states that decriminalized drugs draw addicts from other countries. By the negative's example, only 4,000 out of 20,000 were foreigners that came to take advantage of the lax drug laws, which means that the bigger issue is within the country itself. The issue also fails to focus on the proposition of the decriminalization of drugs instead of just lax drug laws, and how drug possession or use should be diverted to drug rehab. From The Influence by Kristen Gwynn, she shows that other countries have been successful in decriminalization of drugs. In Australia, decriminalization is keeping Aussies out of the criminal justice system and away from secondary harms associated with criminalization. In the Netherlands, a 1995 government report confirmed that the tolerated cannabis market had been effective and was evidenced by low numbers of young people. And in the Czech Republic, they saw an overall drop in new and overall drug users. So what we see is that the harms of criminalization far outweigh those of decriminalization. This brings me back to the solvency that Criminalization of drug use would benefit drug users and society as a whole. Thank you.